Today we're talking to Dr. Colin Alert. He is a family physician and family health specialist, and he lectures at the University of the West Indies, the Clearfield campus here in Barbados. He's also a sports enthusiast. He spent a number of years accompanying national teams on their various engagements overseas. Welcome to you, Dr. Colin Alert.
Welcome. Thank you.
First and foremost, let's start with we talk about elderly care, and especially in this COVID environment. You have a situation where, a lot of us talk about the kind of active lifestyle that a lot of our foreparents would have led in the past, and they're good, strong diets. But why is it that so many of our elderly are coming down with non-communicable diseases?
Yeah, thanks for the question. It's a good question. And it's not just the elderly. What has happened, internationally and certainly here in the Caribbean as well, is that over time, people have gotten less active and their eating habits have changed. So while, say, our grandparents used to ride to work and ride back home or work physical jobs in the field, now, they drive a car, they have a bus stand right in front of them and they flag down a ZR or a bus and go to work. So they don't exercise as much as they used to. And they eat a lot differently. Certainly we've perhaps become a little more prosperous. And certainly we turn on our TVs and see all the fast food outlets in North America. So now we see them right on our shores, So we have tons of different fast food outlets, and that's what we've eaten. And then what has happened as a consequence, this thing called obesity, people being too fat, has occurred. And with that come a lot of obesity-related diseases, high blood pressure, diabetes, heart disease, cholesterol problems, and as well, a lot of cancers. So that has affected our elderly people. In fact, it's drifting down from the elderly into the middle age. And we've been seeing it in teenagers as well. So it's a major problem right now, and it's going to be a major problem even going forward.
What would your suggestion be to deal with this kind of scourge, if you want to call it, on the lifestyles of so many people?
Yeah, well, prevention certainly is the way to go. Okay, and in fact, in 2007, CARICOM ministers of health and government got together and pledged to unite to stop this epidemic of chronic diseases. The thing is, they got together and they had good ideas and good enthusiasm, but it hasn't actually been followed up much with action. And hence, unfortunately, we still have obesity problems. It's getting worse, and the countries are really challenged financially to provide medical care. We live in a part of the world where government attempts to provide the medical care. They got free care in polyclinics, free care in hospitals, and the cost of care is going out of the roof. And, governments are really strung out, right? They don't focus very much on prevention, unfortunately, okay? And that's where we perhaps focus our attention on, to prevent obesity and the subsequent set of problems.
I know it's become even more complex now, because you take the whole COVID situation. COVID is coming and has created some problems. Why are the elderly now, as we go back to talking about the elderly, why are they so vulnerable now in terms of the COVID-19 viral illness?
Well, they're vulnerable in large part because they have the chronic disease to start off with. So their health is not optimal at the start, And if on top of, uncontrolled diabetes or uncontrolled hypertension, you then get COVID, then you're going to be in big trouble. And that's what we're actually seeing, especially here in Barbados now that we hit this second wave. Started this year, say January. We're hitting every couple of days an elderly person who had diabetes or high blood pressure dropping down dead. It's because, before this year, we had tons of elderly people and not so elderly people with these diseases.
What would you then say to those people who are vulnerable as a medical professional? How do they protect themselves, especially the elderly, from catching this virus?
Okay, well, the preventive measures are well known. It's wear a mask, wash your hands, keep the social distancing. So to expand it a little bit, they need as much as possible to stay away from crowds, to stay away from scenarios in which they may come in contact with somebody who's positive. So, we say, well, don't go to church, don't go to the supermarket, don't go to bars, don't go to gyms, those sorts of things. Stay away as much as physically possible from scenarios where you can come into contact with somebody who may have the disease, even though that person may have no symptoms and be unaware of it. So we've limited contact. That has its own issues, but that, is perhaps the safest way that we have at this point in time.
Again, a further complication was listening to the radio yesterday and heard a gentleman call in and talk about his elderly parents, and his father suffering with dementia, and his father's wife. She's also she's much more stable. She's also suffering from early stages of Alzheimer's. What would your advice be to caretakers in terms of dealing with these types of patients, especially in COVID environment?
Well, again, you throw a bumps at me there. Dementia and perhaps more generally, people with impaired mental functioning, those who are not able to take care of themselves, they're a challenge because they obviously need somebody to take care of them, and in the scenario you described, you need somebody to take care of both husband and wife. There are various degrees of dysfunction. Some people can't bathe themselves, they can't feed themselves, they can't comb their hair, they can't brush their teeth. So they require major support. And hence, in that scenario, we're talking about somebody coming in, or maybe a family member, helping them. Obviously, then their risk of COVID depends on the risk of the family member bringing it in, because that family member presumably maybe still works, or maybe has to go to the supermarket, or goes out. So the onus in that particular scenario is for the family member to be extremely careful as much as possible in doing the mask, the hand sanitizing, the avoiding crowds, and so on. But there still is going to be some level of contact with that person. We hope for the best. All right. This vaccine is a good option because at least it may not necessarily stop you from getting the disease, but it stops you from becoming seriously ill or even dying. So we certainly recommend the vaccine, and certainly that's what's good is that our focus has been trying to give as many elderly people, those over 70, and especially those with chronic illnesses, that they should get the vaccine, so at least we keep them alive, and that is as best as we can do in these circumstances.
The lack of activity. I mean, yes, the government has offered some windows in the morning and the evening, but not having that freedom to move around as you like, I'm sure you, as a health professional, you will be concerned that is affecting how people stay healthy.
Yeah, very much so. In fact, I actually written one or two articles in newspapers and elsewhere about this. Yeah, I mean, one of the ways we try to minimize the effect of chronic diseases is to promote physical activity, a minimum perhaps of half an hour a day, 5 or so days a week, promote healthy eating and so on. And certainly what we have seen is that a lot of the elderly people have stayed shut in their houses, have not exercised, and unfortunately, that has actually led to a lot of chronic illnesses becoming more severe. And that has showed up at the hospital. They ended up in hospital, perhaps they ending up in the morgue as well. So that is, not good. We don't have any quick idea. Yes, it's easy to say, well, yes, they're allowed to exercise 6 to 9 in the morning, 3 to 6 on evenings. But in truth, that's not actually happening, especially for the elderly. The younger ones, not too bad. They can zoom down to the beach and zoom home. So yes, the lack of exercise has its own major issues. Not good either for the elderly or even for the younger ones. And again, we no short answers, but it is very problematic.